Good morning, good afternoon, good night. Because I knew in some areas it might be morning, afternoon, or night. So wherever you are welcome to Weekly Healthy Tips. Today is 19th of January 2018, and our today's lecture will be on hand hygiene. Hand hygiene is the act of cleaning our hands to remove microorganisms, soil, with the help of water, ashes, or sanitizer, as the case may be. In medical field, hand hygiene is the washing of hand before administering any medical treatment in order to minimize the risk of getting infection or the risk of spreading disease. The main medical purpose of washing hands is cleaning of pathogens like bacteria, viruses, and chemicals which might cause disease or harm to the patient or to the health worker or healthcare provider. So before we go into deep, let me tell you a story of one young guy. His name is Dr.HM Jahun. He's a Hungarian physician born in the year 1818, and he worked in several European hospitals. Did many researches on hand hygiene. That's why he was popularly known as pioneer of antiseptic procedure. Dr. Ignace published a research which basically deal with hand hygiene. Among the researches that Dr. Ignace publishes is prophylaxis of child fever. I knew many health workers know about this publication. Despite the various publications which shows that proper hand hygiene result in decrease of mortality rates in hospitals or in the community. The work of Dr. Ignace complete the scientific and medical options of that time. His ideas were rejected by the medical community. Samuelis could offer no acceptable scientific explanation for his findings, and some doctors were offended at the suggestion that they should wash their hands before administering any medical care to the patient. Samuelis committed on asylum, where he died at the age of 47 as the result of pneumonia after being beaten by guards only 14 days after he was committed to the pneumonia. So that's how the story of Ignace left. Generally, the act of hand washing is low among Nigerians, either health care provider or common Nigerians. Only about 30 to 40% of Nigerians wash their hands regularly, though this might increase to about 60% shortly before eating food, The situation where hand washing is very essential include, but not limited to: number 1, before preparing food; number 2, after preparing food; number 3, before eating the food, and after eating the food, before touching an injury, and after you touch an injury, before caring or before giving care to someone who is sick, and after touching that sick person, after coming out from toilet, and before also going into the toilet, before touching an animal or pet, and after feeding an animal, before touching any waste materials. It doesn't matter that your hand is not dirty, which will show that your hand is. It doesn't matter that if your hand is not dirty, that you are not carrying pathogens. It doesn't matter that your hand is not dirty, that you are not carrying pathogens after touching maybe patient or after touching any waste object. So we have to clean our hand after doing so. In 2015, there was a report by UNICEF in which about 750,000 children in Nigeria die before their 5th birthday. The disease implicated include those that can be prevented by hand washing. These include diarrhea, which is the second most common cause of death in this age group, that is before 5th birthday. Other groups or other diseases that can be prevented by proper hand washing include common cold flu, conjunctivitis, typhoid fever, hepatitis A, pinworm infection, etc. All this underscores the importance of hand washing in maintaining good hygiene, healthcare, and well-being. Let's look at healthcare providers and hand hygiene. Healthcare providers owe their patient a duty of care to protect them from harm. Healthcare-associated infection-related adverse events occur due to weak infection prevention and control measures in healthcare. These may affect patient outcomes and may have significant cost, medical, legal, and return on health investment. Therefore, healthcare providers should be at the forefront in aligning evidences or policies to ensure proper hand hygiene and effective and efficient implementation of infection prevention control across healthcare facilities. They can galvanize an action to build support based on the fact that sometimes challenging to galvanize action and build support based on the fact can sometimes be challenging in developing countries, but we have to take care of ourselves. We have to prevent ourselves from getting infection. For example, improvement in infection control and prevention practices in Nigeria can reduce maternal, newborn, neonatal, and childhood infection. And those are the associated diseases that cause high morbidity and mortality and has the major challenge in health sector in Nigeria. Let's look at the benefit of hand hygiene. Hand hygiene has many benefits, but we look at some below. It helps minimize the spread of influenza. It prevents diarrhea spread, avoid respiratory infection. to prevent infant death, either maybe at their homes or at the delivery center. Improved hand washing practice have been shown to lead a small improvement in the length growth in children under 5 years of age. In developing countries, childhood mortality rate related to respiratory, diarrheal, and other diseases can be reduced by introducing simple behavioral changes such as hand washing with soap. This simple action can reduce the rate of mortality from the disease by about almost 50%. So intervention can promote hand washing, so it can reduce diarrhea episode by about 30%. Hand washing with soap is the single most effective and inexpensive way to prevent diarrhea or acute respiratory infection or any other diseases like maybe pneumonia. Pneumonia is a major acute respiratory infection, especially in Nigeria, and it's the number one cause of mortality rate among children under 5 years of age. It takes life of about 101.8 million children per year. Diarrhea and pneumonia account the major, mortality diseases in Nigeria. Yeah, some 5 critical times that we might wash our hand, but not up. It can be more than 5 times, but these are the major times. Number 1, maybe before taking meal, after taking meal, before preparing food, after taking food, before going to toilet, after eating yourself, before touching any raw material like fish, like maybe bed towels, before touching any dirty object, and after touching that dirty object, and many times. This, we can organize a campaign maybe by showing the community the benefit of washing our hands. We can put posters in a hospital, in the community environment, and wherever people might wait and see, oh, this is the benefit of washing our hands. So from now on, I will start washing my hand. Don't forget, after watching this video, you should go and wash your hand and search Hafiz Mukhtar Jahun, HAFEEZ, on YouTube for more informative videos. Don't forget to subscribe, like, and share my videos. Thank you. Till we meet in the next week. Thank you.